Hello, everybody, and welcome to a sort of OCD, IOCDF, OCD, SUD, special interest group, all sorts of kinds of things webinar that we're going to do once a month from now on. And I'm happy to be joined by my good friend, Stacey Conroy. Hi, Stacey. How you doing?
I'm doing good.
It's good to be here with you. Stacey, why are we here?
We're here to talk more about OCD and SUD. As we've been saying for a long time, that there are many in the community who are dealing with both. And we wanted a place for them to come and be able to ask questions and get a sense of community and know that they are not alone. Because that's one of the biggest factors for people in both communities is just learning you're not alone. And when you combine the OCD and the SUD, they play off each other. They can make it so much harder. And the OCD community might not know as much about SUD, and the SUD community might not know as much about OCD. There we go.
OCD. Yeah.
I forgot my acronyms.
That other thing. Yeah.
Yeah. You know.
Hey, so do you want to tell people what SUD is and why, just what we're talking about?
Yeah, it stands for substance use disorder, what we used to call addiction. But addiction came with some, negative connotations in some realms, and we really wanted to put it in the same category as other disorders: post-traumatic stress disorder, obsessive compulsive disorder, substance use disorder. Because it's not just a thing that you can go and stop it. Like, what is that?
The Bob Newhart. Yeah.
Bob Newhart. Yeah, just stop it.
Mm-hmm. And what can I be addicted to?
Well,
what can I have a substance use disorder around?
There many, 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 many things.
Right. It doesn't just have to be illegal drugs, right? It could be prescription drugs as well, too.
Yes.
It could be, and it could be things that are legal, like cigarettes and alcohol as well.
And marijuana.
Yeah. So we're really going to talk the full gamut. Now, many of you are familiar with my Wednesday night webinars where I do an hour of OCD Q&A. And if you're here for that, we will do some OCD questions, but just so everybody is aware, the priority for this one is going to be OCD and substance use kinds of discussions and questions as well too. So those will take the priority of all of the questions that come in through the feed. And this will be really broadcast more and advertised more through like the OCD Foundation and our special interest group and our friends, like we have friends over at Game Changers and Margaret Sisson and everything as well too. So with Riley's Wish. And so, this is going to be a place that is going to be, shall we say, kind of agnostic of any one particular group and welcoming to everybody who has any potential struggles with obsessive compulsive disorder and substance use disorders, and also friends and family members of people who would be struggling from any of those concerns as well too.
Yes. And just if people don't know, I am a licensed therapist, but I'm also in recovery from both. So I have lived experience as well as professional experience. So I see both sides of the coin, and I'm here in both capacities.
It's always interesting when I have a guest. I typically ask them more on the personal side of things, Stacey, before we get into some of the more professional stuff. But I'm wondering, as much as you're willing to share your story of struggling with both OCD and SUD, if you might talk a little bit about that for people to understand how these two things are actually linked to each other and get a first person view of what it's like to have both, struggle with both, get treatment for both, learn to live with both of them as well.
Yeah, no. So for me, the first treatment came for the SUD. That was, paramount in my life. I started using multiple substances, drugs, and alcohol as an adolescent. and had subsequent consequences from that. And so I initially went to treatment for substance use disorder. And I've been in recovery for like, I think 28 years at this point from that aspect. So when I went to detox, they didn't even have, like, dual diagnosis was the new thing. I
Mhm.
was one of the, first patients to have access to the dual diagnosis treatment, which was only the fact that you had a room on a different wing.
Yeah.
We're not
Yeah.
quite sure what to do with y'all, but we know
Mhm.
you're different.
Mhm.
And
Put 'em over there. Yeah.
yeah,
Mhm.
put them over there.
Mhm.
Um, so I did a lot of my SUD recovery first, really white knuckling it and holding on. I had a great sponsor. I would go to her for what I now know is reassurance, and she would just look at me and say, "Sit down, be quiet, listen, because you're just another bozo on the bus."
Mhm.
And
Mhm.
that was all I would get from her. And I would say, "Well, what if I die?" She goes, "You're
Mhm.
gonna die someday. It's
Mhm.
probably not today."
Mhm.
And not say anything else. I was like, that really didn't work for me. Um, then, because I also have PTSD, so I have that to add into the
Why not?
complexity.
Yeah,
Yeah,
anything
why not?
else we should pepper in there as well? You want a
Yeah,
few
no,
other
no,
things?
that I think those
Okay.
3 are
You're
sufficient.
good? You're good?
I'm good.
Okay. All right.
Yeah.
That's fine. All right.
So
Mhm.
that was the next onion of the layer to peel back. And I got a lot of treatment for PTSD with, standard cognitive behavioral therapy. And I've often said that made me better, but it didn't make me well.
Sure.
The
Sure.
outsides looked a lot better, but the insides were still screaming.
Okay.
And I had a lot of, harm OCD, that I was going to harm somebody else, that something bad was going to happen to me. My OCD also loves to pick on food and foodborne illnesses.
Mm, sounds
That,
fun. Mhm.
oh yeah, no, lots of fun.
Mhm.
And that's part of my, story, that the OCD I still struggle with. I will cook something and my brain will tell me, don't eat it.
Really?
Oh yeah, yes.
Is that why you threw out the lunch I gave you that one time?
Yeah, yeah,
No.
yeah.
Okay.
Well,
Okay.
it also had to do with the fact I thought you might have cooked it.
By the way, get ready for an hour of this, everybody, where we just tease each other back and
Oh
forth.
yeah.
But yeah. Mhm. Mhm.
Um, so again, it was like peeling back layers of an onion. But when I got to ERP, that really was the game changer for me. It made
Sure.
the outsides and the insides similar. And I
Okay.
learned more about what the intrusive thoughts were, how to push back, how to do ERP, and how to incorporate ERP into my daily life. So I also learned that ERP could be short if it was in the real world.
Mhm.
Um, so I might run into a situation where I had challenges with being in a crowd, thinking, "If I'm in this crowd, I'm gonna hurt somebody, so I shouldn't be here, or put my hands in my pockets, or I have to hold on to something," and I'd be like, "Nope, it's time to be uncomfortable and uncertain and stay in the crowd doing what it is I wanna do." And now you can't keep me out of Disney, no matter how crowded it is.
I know. I see every
Yes.
other week on Facebook. You're. I don't know how you get paid for work. You seem to be live at Disney. So. Mhm.
Yes.
Mhm.
But the OCD and the SUD interconnect in different ways. It's hard to, whether it's a 12-step meeting or a smart recovery meeting, go and sit with people if you're always having the thought, I'm going to hurt somebody in this meeting. I'm going to do something stupid. I'm going to haul off and punch somebody. They're never going to want me back in here. And you can't focus on anything that's going on in the meeting because you're just thinking so much about how you're going to, harm somebody else. Or they say, "Oh, let's go out for food later." And you're like, uh, first I said I wouldn't go. And then I went, but I didn't eat anything. And I got a lot of comments about that. You need to eat. I had people who wanted to feed me. Um, but it just interplays. So it interjects in different ways. And then there's the, did I drink?
Mm.
Did I have a drink?
Oh, interesting. Your OCD would
Yeah,
take that one, huh?
yeah. Did
Oh,
I have a
wow.
drink?
Wow, wow. Hmm.
You know, am I really in recovery?
Hmm.
You know, well, if I want to drink, does that mean that I'm
Ooh,
not?
thought action fusion.
Yeah.
Hmm. Hmm.
um. So yeah, you have all these things. I never had a problem with the religious aspect. I've never interacted with scrupulosity except as a therapist,
Hmm.
but that can come into play too, especially if you're going to a 12-step program
Yeah.
or
Hmm.
a program that has a religious or spiritual component.
Hmm.
That can play into confessing,
Hmm.
making sure I do it right. If I don't do it right, will God judge me? So it can come in aspects like that. So there's a lot of ways that these two can interact with each other, and I also think it can be challenging for treatment. Um, I know, yeah, Margaret has shared that when Riley went to treatment, oftentimes he was prescribed benzodiazepines,
Hmm.
and that set off SUD issues for him. And so it was always a struggle back and forth as to how to address both concurrently, and it's still a struggle,
Yeah.
you know.
Especially because when you're detoxing, benzodiazepines can be something that are prescribed to people who are detoxing to help them through the detox.
Yes, particularly from alcohol.
Hmm. So that's a struggle right there for sure. Hmm.
Yes, and there are the medications, if you're detoxing from opiates, you can get methadone or buprenorphine, and those medications can also be used long term, but that's a treatment. They can be used in detox, but they can also be used in treatment, and people can start to question a lot, particularly if they have OCD, around if it's really, am I really in recovery if I'm on medication? But it's the same thing if you're on an SSRI. It's part of the process, and it can be very helpful to be on those medications. So, you know, I always tell people if it's not broke, don't fix it.
Hmm.
If it's working for you and it's helping you and you're not engaging in those high risk behaviors that come with, opiate use, then you're in a better place. It also allows you to work on the OCD stuff.
Hmm. But if you're abusing it and using it around ERP as
Right.
a way to get through the ERP, we've got a totally different discussion ahead of us then, if that's the case.
Yes, we do.
Hmm.
And we did a talk at the virtual conference, Jonathan Hoffman, myself,
Yes, I noticed I wasn't invited to be on that panel. Thanks. That was appreciated. Yeah.
yeah,
Hmm.
well, you're welcome, you
Okay.
know.
Hmm. Yeah.
Um,
Hmm.
I've already invited you to one for next year. I don't know what your problem is.
I'm ready to go. So, yeah.
Okay,
Hmm.
good. Are you going to fix the slide while we're doing the presentation?
Sure. That's always fun to do, isn't it? Yeah. So,
Yeah,
mhm.
yeah.
Yeah.
And for the record, he did fix a slide. I misspelled something on a slide, and he fixed it in the middle of the presentation.
I thought it was hysterical as an exposure for you to really point out your mistake to everybody. I mean, what great ERP that was right there. Let me just for those of you who don't know Stacey, she has a bit of a visual impairment. So I was like, let me fix the visually impaired person slide. And boy, did we have fun with that, huh, Stacey?
Yeah,
I mean,
why
that's
I'm
fantastic.
talking about the slide, and
Yes.
I never saw it. The only reason I knew about it is somebody commented on it in the feedback and said it would be better if they didn't fix their slides during the
Oh
presentation, and I'm like,
God.
"We didn't do that." And I told Patrick about it. He goes,
Yeah, I did.
yeah, I did."
Uh, oh yes, that was so funny.
Yeah,
We love each other. Yeah.
yeah. So, I mean, that's a bit about me on the fly in the
Thank you.
recovery process. But it was for me, it was very fragmented. And one of the things we would like to do is get more clinicians to be able to do the treatment
Yes.
concurrently.
Yes, absolutely.
Um, would have saved me multiple years.
Well, and there are some similarities between the two that I
Hmm.
think we should really point out. And when I opened Foglia, which was the first residential treatment center that treated both substance use and OCD at the same time, um, we found so many similarities, right? So let's look at safety behaviors. There's avoidance that goes on in OCD and avoidance that goes on in substance use, right?
Yep.
You You may be avoiding people who are nagging at you about your substance use, right? You may try to avoid places that are triggers, but that addiction just pulls you right back into those places, and you start using again. But there's that technique that's there. There's a lot of reassurance seeking that goes on in both, right? And I know plenty of people who would use alcohol, especially our friends in the social anxiety world, right? Who use alcohol as their own form of reassurance to get through social situations because they feel they're inept at doing social things. And so the alcohol is like liquid courage for them to get them through certain situations.
Mm-hmm.
And then go ahead.
Oh, I think I had a brain blip.
Okay. Distraction. I mean, substances can definitely
Oh, yes.
distract you from something that's uncomfortable, right? So,
Mm-hmm.
uh, you know, if
Oh, and
if
the
you don't
fact
want to
that
think
they're
about it.
both never satisfied.
Well, there we go. I
Yeah.
mean, there's always that. Yeah, absolutely. You can never take enough to really
No.
scratch that itch, shall we say. Yeah, it's just never going to be enough to fully get to it, right?
Nope. And it always wants more, and it always tells you if you do it one more, it will be okay.
Hmm.
And
Yeah,
it never is.
never is. Um, Interesting question. One of my main themes is a fear of drinking and eventually becoming an alcoholic. So I'm terrified of alcohol. If I have an OCD theme of a fear of alcohol addiction, so I don't like to be around alcohol, much less drink, how can you know if it's ever safe to have a drink for the first time? Like, is having a drink something that is actually better to do than to avoid or to do an exposure for? So interesting question, right?
Mm-hmm.
I mean, I have not given people using a substance as an exposure. I just have never done that. But I have definitely had people be around things, kind of like you said, Stacey, where your fear was, how do I know if I did drink that or not, or use that substance or not, or something? And so it's better to be away from it, because someday you're going to go to a restaurant and the table next to you is going to order a bottle of wine, right? And you're going
Mm-hmm.
to have to be around those types of things. Or the family party, somebody, Uncle Jim always brings a bottle of scotch to the family party, right? And so do you avoid restaurants and family parties and all of these things for the rest of your life so that you'll never be tempted, or that you'll never have an OCD flare up? Or do you expose yourself to those situations and learn that you can handle those things, right? I know for us, we had at Fogler, we had a virtual reality program for substance use where I could bring people into a virtual bar and serve a virtual drink to them and blow the smell machine off, and the smell of the drink would be there. And people would say before, this is going to be no problem, I'll be fine. And then they'd be doing that and they'd be shaking, right, and sweating. And they'd say, I might need another day or two here before I'm ready to go out. That was more triggering than I thought it was. So,
Yeah.
um, Stacey, could you talk a little about urges and cravings and triggers too? I mean, we know about triggers in the OCD world from my webinars very often, but I think it's important to discuss those types of things from the substance abuse point of view, so that in this first one that we're doing, because it's going to be on YouTube, people can come back and watch this, where people will be able to kind of use this as a reference point. So,
Yeah. I mean, the triggers can be things, smell, taste. So people have been triggered by drinking or swishing and swallowing with Listerine.
mm-hmm,
So, that can be triggering. As you said, you had the smell machine, which I
mm-hmm.
still want to go and stick my head in someday.
It's
Um,
fascinating, by the way.
it
Yeah.
really sounds it.
Mm-hmm,
But yeah, smelling alcohol, seeing alcohol, all of that can be triggering for craving. And it's the trigger for the craving is not the issue, it's the response to it.
mm-hmm,
You know, it's accepting that your brain is your brain and it might have a craving for the substance.
mm-hmm,
If you walk by the place where you used to use, or something that reminds you of it, or you see something on TV, like you're watching TV and there's, drug use in the movie you're watching or the TV show,
mm-hmm.
that can be triggering. There's a saying in 12-step programs of people, places, and things. So people who you hung out with could trigger family, friends who used with you, drank with you, places you went or places you go to, weddings, bars. The interesting thing for substance use disorder is we do say that a little avoidance can be helpful in your first
Mhm.
few months of recovery. Like,
Mhm,
don't go
mhm.
test yourself to sit at a bar.
Right,
If
right.
you go
Not
to
a
a
good idea.
wedding, bring your sponsor.
Yeah,
So it's the one
yeah,
place where a little avoidance can be helpful.
sure.
Not a lifetime of avoidance,
No.
but
Mhm,
enough to get, you a bit more stable in your recovery process and have these natural exposures and respond to them differently. Um, Stress also brings out craving for SUD,
mhm.
just like stress can bring out symptoms of OCD. Going to college can, if you're in recovery as a teenager and you go to college, that is a big time for relapse to substance use disorder. So there are a lot of similarities where you would find OCD symptoms might go up, where SUD symptoms would go up similarly in the same situations.
Yeah. We had, we had one comment here that said, "Uncle Jim, typical for bringing that bottle of scotch to the program there." There's a few things that I'm seeing, and I think that this is important. A couple of people have talked about how the significant use of marijuana has been a trigger for OCD for people, and especially if that marijuana feeling is one of paranoia. And I've seen this just
Mhm.
clinically as well too, where there's a lot of paranoia, and that can become the stressor that can kick off some of the OCD experiences for people, and they develop fears, as one person said here right off the bat, um, fears of schizophrenia or psychosis or something of that nature. Have you seen that as well, Stacey?
Oh, yes.
Mhm.
Yes. And unfortunately, the message out there right now is that marijuana is a cure-all, and it's not, but that's the messaging. And I think that's causing some confusion for people, and when I did the talk for the virtual conference, we all said, "You as an individual have to decide what does and does not work for you."
Right.
And some people who use marijuana will experience paranoia, psychosis, hallucinations. It is a powerful, powerful substance,
Mhm.
and not everybody responds to it the same way.
Mhm.
Just like alcohol, alcohol is legal. There's a
Mhm.
whole bunch of us running around who can't use it.
Mhm.
Yeah, I have one drink. Mm-mm. Sorry.
I don't wanna see that.
No, no.
No. Mhm.
Um, And a matter of fact, even at the conference, there's a joke. There have been years where for speakers, they hand out little tickets so you could get a free drink. And,
Yeah.
I'm blacklisted. I get no tickets.
Yeah. I mean, I say that tongue in cheek a little, but also seriously, I wouldn't wanna see you drink, right?
Yeah.
Because I know how much effort you've put into your own recovery, and I wouldn't wanna see you do that. I wouldn't want to see you. Not that I know that sometimes there's the view that, one drink and you're back to day one and everything. I don't necessarily myself prescribe to that kind of concern, because I don't do that in OCD as well either. I don't see one compulsion and you're back to you need therapy all over again day one kind of thing. But I also just like I don't want to see anyone do a compulsion. If someone had a substance use issue, I wouldn't want to see someone use a substance as well either. So,
Right.
mhm.
Well, and I've said this before. There's the cucumber and the pickle.
Yo, Mark, here. All right, everyone. This before you get into this, everyone, perk your ears up. Fantastic example coming. Please pay full attention. Go. Mhm.
Okay. So the way you make a pickle is you put a cucumber in vinegar. So you have a cucumber, and those are people who can drink. They might drink socially. They might even occasionally have a problem with drinking due to a divorce, stressors, job loss. So they might drink more, but technically they're still a cucumber. Then there are people who have severe substance use disorder, and they are pickles. Now, you can make a cucumber a pickle, but you cannot make a pickle a cucumber ever again. And I am
Love
a
that.
100% pickle. I will never
Bravo.
be a cucumber again.
Bravo. Bravo.
So,
Yeah.
I might get away with having one drink and then going, I had one drink.
Oh, yeah. Yeah.
I did it.
Mhm.
The problem is next time I'll probably have 2, and the
Yeah.
next time I'll probably have 6,
Yeah.
and then I'll be off and running.
Mhm.
So it's important also to realize that there are some people who might have drank too much at one point in their life, and they were able to return to more sociable drinking. That is a distinction between cucumbers and pickles. It doesn't mean that alcohol wasn't a challenge for you at some point, but you weren't a pickle. You were a
Mhm.
cucumber who was
Mhm.
drinking too much.
Yeah. Yeah. Hey, our friend Lauren is listening, by the way. So, hi, Lauren.
Hey,
Just
Lauren.
want to say hi. She's the one who said Uncle Jim typical. So, and as always, we will be welcoming guest speakers to join us on this monthly as well too. So we'll have Lauren on in the future and join us with everything. But if any of you also would like to come on and speak of your story of struggles with OCD and SUD and how you have gotten through those, we always love to have other people come and join us and speak to that experience as well too. So. And now everyone's joking about pickles right now on the
Yeah.
on the feed. So, mhm.
I'll give you one example. I actually went on a cruise. I had never been on a cruise before, and first day having a great time. At night, I got this thought that I was going to go out on the veranda and jump off the
Mm.
veranda and die in the middle of the ocean, and nobody would know why. And you get into that thought process. I'm really going to do this. No
Mhm.
suicidality whatsoever.
Yeah, of
Having a
course.
great time. This is purely an intrusive thought. It's really blew up, and I wasn't expecting it. So I'm like rolling my hands in the sheets and all of these things, like I'm going to secure myself to the bed.
Mhm.
Um, but in that, you're on a boat. There's nowhere you can go. So when you find yourself, the OCD kicks up, your brain goes, well, you could make this quiet if you, smoke marijuana or had a drink or, just take care of it because you're stuck on a boat and then it will be quieter while you're on vacation. And you're like, no. So they play off of each other sometimes too. One will say, well, if you just have a drink, the intrusive thoughts will go away. And then the intrusive thought says, well, if you're thinking about having a drink, you've already relapsed. So,
Yep. Mhm.
you know,
Nicole says, "I always feel like having a drink."
yeah.
So and she put an LOL on that as well too. Yeah. We have some other ones. Leanne says, "I identify as a pumpkin instead of a cucumber," which I like. And then Theodore gave a good joke. Says, "I'm relishing the pickle talk." So that was pretty good too.
Yeah.
Enjoy that. Thank you. Um, you know, Stacey, one of the things that I was fascinated with when I was at Foglia's, I had someone come in who was on his over 25th, I won't give exact numbers to give away, but over 25th detox. And I sat down and did an anxiety interview with this gentleman. And after I was done, he said, you're the first person who's ever asked me about anxiety. And one thing that I will shout from the mountaintops, and I think you'll agree with me, is why do we have two separate camps? Why is there a mental health camp and a substance use camp? And why can't we all be together? Because I think it's actually done a disservice to our communities that we separate these things out so very much. Like, I've told this story before, but I'm happy to tell it again. I could have gone through graduate school without ever taking a substance abuse class.
Hmm.
I took one purposely. I went outside of my department to another department and purposely took one because I didn't think it was right that I would graduate with a PhD in psychology without ever having taken a class in substance use.
Yes. The long and short of it
Yeah.
is substance use disorder did not originally fit into the disease model.
Mm-hmm.
And it very quickly became a legal issue rather than a medical issue. It
Mm-hmm.
also became more of a legal issue than a mental health issue. So starting in 1914, they started passing laws outlawing heroin, opiates, cocaine. And as the disease model grew, where we knew more about symptoms, were led to the diagnosis, you would address the symptoms. Substance use disorder became a legal issue. Everything else became a medical and mental health issue. So professionals, the psychology, social work, MDs, weren't trained to address legal issues. They were
Mhm.
trained to address mental health and medical issues. Therefore, they sort of diverged, and this became a specialty. SUD, substance use disorder, became a specialty
Okay.
apart. And the people who wanted to work in that field were individuals who they themselves were in recovery.
That's something we'll come back and talk about. Yes,
Yes.
that's a big one to discuss. Mhm.
Yes. So the industry grew up around, if you had a substance use disorder, you went to go see your peers
Yes.
who had experience and could show you how to get into recovery. Actually, it was, now that we talk about peer support specialists all the time, SUD, we've been doing this for decades.
Mhm.
you know? Um, so really all you needed to do to have a job in the SUD field, whether that be a counselor at a detox or a halfway house, was to have between 2 and 5 years in recovery yourself. There was no degree needed. You didn't need to be a psychologist or a social worker. And actually, in my own career, that's how
Yeah.
I got started.
Is
I
it?
was
Okay.
actually providing therapy and facilitating groups and utilizing CBT and 12-step facilitation in residential programs, writing the same notes as the social workers down the hall in the mental health program,
Yeah.
um, and getting a fraction of the pay. So I
Right.
went, I need to go to school.
Yeah. Yeah, yeah.
Yeah.
Mhm.
So that's really how they diverged into two separate things. The other aspect of that is insurance payments.
Mhm.
Insurance has never been really great with either mental health or substance abuse.
Mhm.
However, in the beginning of substance use disorder, it was a 30-day detox. Well, the relapse rate was so high, the insurance industry sort of said, "Why are we paying for 30 days? 90% have, a relapse within a given set of time. We're gonna shorten it to 5 days because that's when we know the medical risk is over."
Gotcha.
If you
Okay.
don't go into the delirium tremors or have a heart attack or have some kind of medical emergency after 5 days, then we're good. We've done our part. The rest is go to SUD treatment.
So the physical has been mostly washed out at the 5-day mark, but the psychological is still there
No,
for sure.
the emergent
The
physical,
okay, thank you, thank you.
yes,
Okay.
is
All right.
washed out at the 5-day mark.
There we go, there we go. Okay.
Yes.
But because you could still, I mean, I've heard people describe months of feeling still like there was stuff going on, and you can do a drug test on someone and find marijuana in a system a month after you've used it, right? That it can
Yes.
last that long, so
Well,
mhm.
marijuana is stored in fat cells, so it hangs around
Well,
longer than opiates, alcohol, or cocaine.
gotcha.
But you can find those substances in a hair follicle. Like,
Mhm.
some employers will do a hair test because a urine test you'd pass, but a hair follicle test you would not pass.
I see. Mm.
So different mechanisms in the body. But the emergent is over in 3 to 5 days.
Okay,
So,
thank you, thank you. Yes, that
but
makes a lot of sense.
the
Mhm.
research shows us that between 45 and 90 days is really where the body starts to heal itself.
Okay.
There's a bell curve for people who understand it. It goes
Mhm.
up to the highest point where, and it's about 45 days, and then you start coming back down, which is 90 days. Now, we only had that research in the last 15 years since we started having, MRIs. And Nora Volek, who's the head of the National Institute of NIDA, um, Drug and Alcohol Studies, I believe,
Mhm.
um, she started doing these studies and found that it was 90 days. The interesting thing about that is 12-step programs have these unofficial, community beliefs.
Yeah.
And one of them is 90 meetings in 90 days.
Right.
Well, that's observational data. They observed that people did better after 90 days. So the first 90 days were
Okay.
the dangerous part for them,
Gotcha. That makes sense.
you know, but they didn't have an MRI machine. That decision was made back in the 1960s and 70s.
Just from observing. Yeah. Okay.
Yes.
All right. That's cool. And of course, just like OCD, which there will always be intrusive thoughts or images or urges that even people without OCD have. So those are just normal human things. As kind of, as you said, it's the reaction to the experience itself, not necessarily just the experience, right?
Right.
Do you feel, and I know the answer to this, but I think it's good for all of our listeners. Do you feel like SUD would be the same, that for your lifetime, there will be potentially that struggle, that urge to go back and just one more time, or try something again, or see if I can handle it this time better than before? Or is that always there?
Oh no, it can come up again and does for many people, and I think that's one of the things we don't talk about. Because like I have 28 years, so people are like, "Oh, you're fine." Do I think about it daily? No. Do I even think about it, often? No. But there have been times I was 13 years into my recovery process and I got, stressed out due to, you know, mental health symptoms, PTSD, OCD. I was in a bad place mentally. I was having some health issues. I got really stressed out and I got a ton of cravings coming back. And the ironic thing for me is at that point, I was 13 years into recovery, so people were coming to me to help them with their recovery, and I'm thinking, "My recovery is not good right now."
Yeah.
I was fortunate because I reached out to somebody and I told them that, and they got me into some group therapy at 13 years in recovery specific to SUD, and I did that for another year to sort of take care of some of my health issues and right the ship. But a lot of people don't do that because you're supposed to be okay. Once you hit 10 years, particularly in 12-step meetings, they consider you, an old timer, double digits. You're supposed to have the answers now. And there's not this movement to say it's okay not to be okay. You're now, a senior member, you're a leader. So that can be hard to find people who you can talk to when you're struggling so you don't relapse on, substances. Um, I've heard others talk about what does it mean to be in recovery and what if OCD, intrusive thoughts come back in times of stress, you know, can you talk about that? And having those supports in places where you can is really important.
Absolutely. And there are points where we're just triggered. Sometimes it triggers out of the blue, and sometimes we can identify a very specific thing that was the trigger to it. No one is free of triggers in this world,
No.
right? Until we die, there are things that are going to trigger us. And, Stacey, you might agree with me here. I've said on this before that I can't go a day without being triggered, and I don't even have OCD, but I've treated so many people who do, that I've absorbed every intrusive thought that all of them have ever had, that now whenever I do anything that reminds me of anything I've ever treated anyone for, I experience that same exact intrusive image or urge or thought that they did. Like, Stacey and I are at conferences together all the time, and you grab onto an elbow, I help you get around when we need to go places through crowds and everything, and we could be at a stairs. And Stacey, I'll confess to you, I've thought about throwing you downstairs, not just because it's me, but because I've treated people who have had the fear, what if I would do that? And since you've been next to me on a staircase while we've been going down it, you've been the subject of that intrusive thought, because I can't take stairs anymore without thinking, well, I could totally push somebody down these stairs right now.
I'm going to watch you a lot closer at the next conference.
But you know what I mean, you get it, right? You
Yeah.
understand that 100%. I know you do. Yeah. So,
Oh, no, absolutely.
yeah.
Um, and it can pop up at the strangest time.
Of course. Mhm.
I also have metaphobia, and Ethan Smith had the nerve at a conference to get food poisoning,
Oh, I remember
and
Chicago.
everybody was
Yeah.
talking about it. I couldn't like I was like leaving conversations left and right,
Yeah. Mhm.
you know? Um,
Well, our friend Chrissy Hodges has a great story on that too that I was a witness to one time where a friend of ours, I will not name this person, was sitting in the front seat of the car and had told everyone that they had thrown up, and Chrissy, and then they opened the window a little bit and they were breathing. So Chrissy thought the vomit germs were blowing back at her in the back seat, and she had to get out of the car. And
yep.
and then the next day found out it wasn't throw up, it was something else that
Oh,
had happened to this person. And so how it was all just in the head of the person.
head.
So I love you, Chrissy, and we tell that story every time we're at Game Changers to everyone. So I'm not giving anything away for Chrissy there, because we have shared that story a great deal in public.
Oh, yeah.
But yeah, it just takes something in your head to create that. Right? That's all you need.
And you wanna know great exposure?
What is it?
Have metaphobia and work at a detox.
Oh, I bet. Yeah, because people do throw up at a detox
Oh,
thing.
yeah, they do.
Yeah. Hey, Stacey, Nicole asked, did you get into doing therapy because your history of OCD and SUD?
Yes.
Mhm.
I got into therapy first for the SUD. As I said, mine was very tiered. Uh, Concurrent treatment wasn't the thing when I started. So first it was SUD, then it was PTSD, and then it was OCD. So
And then what made you do the switch to go, I think where they're leading here, from getting therapy for yourself to becoming a therapist? How did you kind of go to that route?
oh, okay. Well, again, I got into recovery, and one of the things I saw was there wasn't a lot of evidence-based treatment at that time for SUD, and the relapse rates were really, really high. We had 12-step programs, and they are helpful, but there was nobody doing therapy for this, and I wanted to get involved. So got I got a job as just a person in recovery and started doing CBT
Mhm.
and 12-step facilitation, and I was the only person in my program doing it. Even my supervisor said, "I covered for you when you went on vacation, and all your clients came in with their homework." She goes, "How did you get them to do homework?" I said, "Well, I'm doing CBT with them. It's part of the treatment."
Right.
And I
Mhm.
told them it's their recovery. If they don't want to do the homework, that's fine,
Yeah.
but it's
Don't
their
expect
recovery.
great recovery. Yeah,
Right.
exactly.
What'd you come
Mhm.
here for?
Mhm.
So, um, but then again, also, I wanted to make a living, so I transferred from more of that recovery person to I needed to get into school and get a degree because I would have access to more training, more evidence-based treatment, and that's played out to be true. Um, I do a lot with, you know, evidence-based treatment. I did a lot with education around uh, medication-assisted treatment because there used to be this theory if you can't take a med for a substance use disorder, it's not allowed. But as it's become more acknowledged as a medical issue, that medications are options, but a lot of people had to be trained in that. So I've done trainings in different states. I've done trainings that are online, teaching doctors and psychologists about medication assisted treatment, how to pair therapy, behavioral treatments with the medication assisted treatment, like we do often for OCD with meds and behavioral treatment. Um, so the transition was just a natural of
Mhm.
wanting to bring recovery to more people and realizing there wasn't a lot out there in the professional world when I started my journey. It
Mhm.
was basically AA or bust,
Yeah. Yeah.
you know? And
Mhm.
I talk a lot about 12-step programs. I utilized them for over a decade. I found them very helpful. I tell people that's not the only way to get to
Mhm.
recovery.
Mhm.
You know, you can go out and hug trees if that works for you.
Oh, a tree. Oh.
Yeah.
Mhm.
Hey, if it works, it works, you know? Um,
Mhm.
but I really think one of the things that I have learned is you need an avenue where you can be honest.
Yeah.
And if you can be honest in your church group and really say, I had a craving for heroin last night, or I slipped and I got drunk, and you can do that, that's a place you can go. If you could do that with, you know, a smart recovery group, women for sobriety, any type of support group, it's just the ability to be able to say when you're struggling and get that support. That is key. If you have to keep a secret, then it's not a therapeutic place. It might have other roles in your life, but it's not the therapeutic place.
Mhm. Well, boy, can't we apply that to OCD too? You know, if you're secretly doing compulsions and safety behaviors
Mhm.
and wondering why you're not getting better, we have an answer, right? And that is the fact that the secret safety behaviors are occurring are the things that are keeping OCD around. OCD loves a secret safety behavior.
Yes.
Mhm. And one thing you said earlier, which is important about homework, if you went to piano lessons and all you did was take the lesson but didn't practice between piano lessons, you only get half an hour better every week. And it will take you about 78 years to potentially become a concert pianist if that's the rate that you're going. Or you could practice between and really accelerate the potential to become a concert pianist if that's the case. Mhm.
Yes. Lots and lots of homework.
Oh, isn't there? Yes. And also willingness to be uncomfortable,
Yes.
because OCD and substance use both offer you something which is immediate relief if you do a compulsion or if you use. You want
Yes.
immediate gratification? I have the answer for that. Here's what you do, and your life will be better if you use it.
And then it wears off and you do it again
And again,
and
and
again.
again, and again. And
Yes.
it just goes and goes and
There's
goes and
actually
goes.
a saying in NA, one is too many and 1,000 is never enough.
Right. Right. Yeah. And how true is that? Right.
Yes.
Now I think let's just throw out a few numbers here before we get toward the end of tonight. This has gone by very quickly, by the way. Um, we, I think, know now statistics wise from some of the research that's been done that, and it may shock people, that up to a third of people with OCD are abusing substances as a way to manage their OCD.
Mhm. Yes. There are several older studies that say it's 25% have a lifetime prevalence, which means SUD came into their life at some point, for people who have OCD. There are, there's a study that looked at veterans
Mhm.
who sought VA care for SUD, and they found that 36% of them had qualified for a diagnosis of OCD.
Mhm.
And there are 2 studies that looked at substance use disorder for individuals with, body dysmorphic disorder, BDD, and that's up to 40%.
Mhm. Mhm.
So, it's a significant concern in the community, but it's not one that people are talking about a great deal, and one that often doesn't get treated concurrently.
Yeah. And why people unfortunately bounce from treatment centers to treatment centers, because they're not addressing both of the things. One of them becomes a hidden disorder for many people, right?
Yes. Yes,
So,
on both sides of the camp,
both sides. Yes,
because
absolutely. Mhm.
I started treating in SUD, and as I learned how to treat OCD, I started asking questions, you know, "Do you have unwanted thoughts?" And
Mhm.
people are like, yes." And I found a lot of the people who we listed as treatment resistant in the SUD treatment programs was because of OCD.
Mhm.
And I would do something as simple as give them a book on OCD. And they'd come back to me and go, "I had never heard of this before.
Mhm.
This is me."
Mhm.
But it's not part of the intake that I'm aware of in any substance use disorder program. 2 questions could be asked.
Yes, let's talk about the 2 questions because it's very important to talk about the 2 questions. What are the 2 questions?
You're gonna put me on the spot. Thanks.
Nope, I'm happy to go with the 2 questions as well too. So,
Yeah.
I
Well,
mean,
I one of them that I'm aware of is, do you engage in any behavior that don't want to repetitively, or have any
mhm.
intrusive thoughts that you have repetitively?
Yep, yep. Yeah, and it really goes along with that. One's around obsessions. Do you experience any thoughts or images or just that you find to be inappropriate that really bother you? And then the other one, do you do any mental or physical behaviors over and over again to try to alleviate those? Very simple. But on the substance abuse side, there's 2 important questions as well too, right?
Yes. Have you ever used, substances to an excess where you had negative outcomes?
Mhm.
And has anybody, told you about your drinking or substance use?
Yep.
You know,
That
again,
they think it's excessive. Yeah. Mhm.
2 questions on either side could really help people engage in treatment more effectively,
Mhm.
but we don't use them.
Yeah. Are there any red flags to keep an eye out for that one is sensitive enough to developing an alcohol substance use disorder that's best to avoid trying alcohol entirely? I don't think that there probably is, right? I mean,
No.
you we know that there's predictors, right? If you have a pretty good family history of alcohol use, then maybe it's best to delay. People would laugh at me in college, and I was in a fraternity, and I did not drink till I turned 21. My 21st birthday was the first time I drank because there was enough statistics out that showed that if you delayed drinking later, you would develop less of a chance of developing a substance use disorder problem. And I come from a good Irish family that has on both sides people who have had issues with drinking. And I kind of just read that even as a kid going into psychology that I knew I wanted to do, and seeing some of the early research, I was like, I made a personal decision not to drink until I turned 21, and I did not.
Mhm. No, there unfortunately are no, you can't take an MRI or a blood test or anything like that and know that you're higher risk. Family history, genetics do play a role, so you take
Mhm.
that into consideration. But I've worked with people who have no family history,
Exactly. Yeah.
you know?
Just like OCD, yes, you have a greater chance of having OCD if a first degree relative has it, but you can have nobody in your family who's ever had OCD and develop it as well.
Mhm.
So, Stacey, as we're going to do this monthly now, which I'm really excited about, by the way, I
Yes.
think that this is, been in the planning. There are a few things in my life that got in the way of this starting a little earlier. My apologies, but
Yeah.
yeah, but we're here now. So, what's your goal in doing this, and what do we want to get out of this? Do you think?
Well, I'm hoping that we can, share widely among some of the different, platforms for people knowing that this is here. And like I said, really to allow people to come and ask questions, to provide some information, to know that they're not alone. One of the things, too, is we have the special interest group
Yes.
through the International OCD Foundation, the IOCDF. That website is www.ocd.com. There's resources there.
Is it ocd-sud.com or is it OCD?
No, just OCD.
OCD.com. Mhm.
Yep, yeah, OCDSUD.com. Yeah,
There we go.
6
OCD-SUD.
letters.
Yes.
No special characters.
Just OCD-SUD.com. There you go.
Yeah.
OCD-SUD.
Um,
Mhm.
and again, the idea here is to build a community, a place where family, friends, people who are struggling with this, professionals, anybody who wants to learn more can come ask questions, because there's just not that opportunity. We do it twice a year at a conference, and
Mhm.
that's it. And that's not enough. That's not enough.
Yeah. I'm excited to bring in some special guests and hear other stories that will be motivating to people how people have gotten through this and come out the other side. We know several people in the therapy community who have done this and are now well known in the field. And so it's very important because not enough people talk about this. And Stacey, we know people who have died because of this. And
Yes.
to be honest, that's what it really comes down to for me. I don't want another senseless death to happen to anybody because something was missed, right? I don't want to ever see that happen again. And so it's important for us to, take the reins in this experience and really push this out there and get this out in the forefront that you know we we don't have to hide one thing or the other. Let's get rid of the stigmas of either of these things, and let's just have an open and honest conversation for everybody.
Yes.
Mhm. So, well, with that, everyone, thank you for your time. We really appreciate you all being here tonight, and we are going to do this every first Monday of the month, I believe, Stacey. We've got this
Second.
or the second. Oh, it's the second Monday of the month. Yeah, look at that. Jeez.
Yeah.
I'm good at counting, by the way. So it's the second Monday of every month we will be doing this, and it'll be great to have this time together. And if you know anybody who's interested in joining us or wants to talk about particular themes or anything of that nature, I think that it would be important too. There's various diagnoses, kind of like OCD induced substance use issues. So we can kind of break down some of the diagnostic aspects of some of this stuff and talk about, when you would diagnose what and why and how and all those things. And we could talk about all sorts of levels of care that people could go through, be it from support groups that you might attend all the way through residential treatment centers. And we're excited to have had all of you joining us tonight, and we look forward to seeing you all again in a month. Appreciate it. All right, Stacey, I know you'll be at Disney at least 7 times before next month, so enjoy every one of your
7?
trips. Is that low?
Have you met me?
Is that low?
You have access to my Facebook page. I'll be at Disney 7 times before Martin Luther King Day.
I heard that you bought property right on the resort there. Actually, is this true or?
No, I don't have that kind of money.
Oh, okay, all right.
Yeah, the cheapest place is like 2.7 million.
You only have 2.5, so you couldn't.
Yeah, exactly. Yeah, spread rumors about me on the internet. Yeah. Thanks. I don't have money. Don't call me. I'm a social worker.
Yeah, right. That'd be a good bumper sticker. I'm a social worker. All right, everyone. Thanks for joining. Appreciate it. We'll see you in a month.